Hi, everyone. My name is Lori Peak, and I am the principal investigator for the National Science Foundation supported CONVERGE facility, which is headquartered at the Natural Hazard Center at the University of Colorado Boulder. CONVERGE is dedicated to connecting researchers across disciplines to advance ethical, interdisciplinary, convergence-oriented research. On behalf of the entire team, it is our pleasure to welcome you to the CONVERGE webinar series. Today, during this brief 30-minute demonstration webinar, we are going to share the latest CONVERGE training module, which focuses on broader ethical considerations for hazards and disaster researchers. This module builds on our previously released CONVERGE Institutional Review Board, or IRB, Procedures and Extreme Events Research Training module. In particular, this newest module moves beyond the IRB to address a number of ethical dilemmas and challenges that may emerge in the context of hazards and disaster research. For our participants out there, if you have ever confronted thorny ethical dilemmas such as understanding and managing participant expectations, grappling with whether unequal giving to participants is ethical or unethical, or considering what it means and why it is important to return data or findings to a disaster-affected community, then we hope this module can help you find your ethical compass and build a toolkit for your hazards and disaster research. We are thrilled that you have joined us today and look forward to engaging in these conversations with you. A few logistical items before proceeding any further. This webinar is being recorded. The captioned recording and slides will be posted on the CONVERGE website at converge.colorado.edu. Should you have any questions or comments during the webinar, please use the Q&A box or the chat box. If we are unable to respond during this brief webinar, we will post written responses on the CONVERGE webinar webpage for this session. One of the major tasks of the NSF-supported CONVERGE project is to accelerate the education and training of a diverse next generation of hazards and disaster researchers and practitioners. We recognize that disaster research is often highly event-driven. In order for the field to progress, it is crucial that those new to this area of study have access to already existing research and an understanding of various methodological approaches and potential ethical challenges. To help, our CONVERGE research team is creating a series of free online training modules that are specifically designed for students, emerging researchers and practitioners, and others new to the field who hope to quickly background themselves on key information. Thus far, we have released modules on social vulnerability, disaster mental health, cultural competence, IRB procedures for extreme events research, conducting emotionally challenging research, understanding and ending gender-based violence in fieldwork, and, as you will hear about today, our 7th module in the series is focused on broader ethical considerations for hazards and disaster researchers. Over the coming years, we will continue to offer individual certificates for each of these modules, while also building toward a credentialing system for hazards and disaster researchers to help ensure a minimum competence in the field. I am also excited to share that thanks to a partnership with the International Association of Emergency Managers, or IAEM, we can now offer 1 contact hour of general management training for each completed CONVERGE training module through the IAEM certification program. You can learn more about this on the CONVERGE website at the training modules page. These training modules can also be used as a classroom assignment or competency requirement to ensure that students and others new to the field have a baseline level of knowledge and skills as they move forward with their efforts. To further encourage classroom adoption, we have partnered with educators to create the CONVERGE Training Modules Assignment Bank. We already have several model assignments posted on the CONVERGE Training Modules webpage for classes at both the undergraduate and graduate levels. So to all the educators out there that I see on this webinar, if you have used this training module in your class, we would welcome your contribution to the assignment bank. We hope you will contact us at converge@colorado.edu if you have an assignment to share. And I just want to say how fulfilling and exciting it has been to see dozens of students sign up from many different universities across the US and around the world who are clearly taking these modules as part of a class. So thank you for that. The training module that you will hear about today was made possible through an award from the National Science Foundation, Division of Civil, Mechanical, and Manufacturing Innovation, with supplemental support from the Centers for Disease Control and Prevention, which we gratefully acknowledge. The Broader Ethical Considerations training module development was co-led by Dr. Rachel Adams, who is a research associate at the Natural Hazard Center and with the CONVERGE initiative, and Candace Evans, who is a graduate research assistant at the Natural Hazard Center and for CONVERGE. Rachel and Candace have worked for several months on writing and developing this module and have received regular feedback from our partners at the CDC. Rachel will be providing an overview and interactive demonstration of the training module. The hope is that after you have seen this module today, you might consider using this in your own classroom, research lab, or other professional setting where it can help you, your colleagues, and/or your students. With that, I'm going to turn the presentation controls over to Rachel now. Rachel?
Thank you so much for that introduction. As Lori mentioned, my name is Rachel Adams, and I'm a research associate at the Natural Hazard Center and with CONVERGE. Over the past several months, I've been working with Candace on reviewing the literature and developing a number of case studies that appear in this module. Today, I'm going to start by providing an overview of the Broader Ethical Considerations training module. Let me take a moment to orient you to the structure of the module. What you can see right now is the Broader Ethical Considerations training module is organized into 4 lessons: background, ethical considerations for designing a study in a disaster setting, broader ethical considerations and challenges in disaster research, and strategies for conducting ethically sound disaster research. Within each of these lessons are different topics, which present interactive information that aims to achieve a specific set of learning objectives. By the end of this module, participants should be able to define research ethics in the context of disaster research, explain how disaster research ethics includes not only designing the study for IRB review, but also recognizing and addressing ethical challenges as they arise throughout the research process, describe how ethical concerns infuse the entire research lifecycle, from research questions to the sharing of data and results, list 6 aspects of study design for which ethical decision-making and action is applicable, identify 6 broader ethical considerations and challenges that can occur in the context of disaster research, describe 9 strategies that can be employed to address broader ethical challenges in disaster research, and finally, apply a more robust set of guiding ethical principles and an ethical toolkit to help inform the ethical decision-making and action. On the right-hand side of the page, there is a tracking bar where you can track your progress as you move through the module lessons and topics. Once you've completed a topic, you can always go back and review at a later time. Within each of the topic pages, information is presented through written text and a number of case studies, which are designed to provide context and present the information through real-life examples. In addition, we also use a number of infographics, tables, and sliders to illustrate the content to users. For instance, within the ethical principles guiding institutional review board procedures topic, we utilize a slider to highlight the 3 core principles of ethical research: respect for persons, beneficence/non-maleficence, and justice. In addition to the module's written and interactive visual content, we have compiled a list of additional resources relevant to broader ethical considerations in disaster research. Within the Resources tab, at the top right-hand corner of the screen, we provide links to tools, instruments, trainings, and other relevant resources that you can access. Please note that you must be logged into the module to access these resources. At the end of the module, you can take a 10-question quiz to assess what you have learned. All in all, the module takes approximately 30 to 60 minutes to complete. If you are an instructor considering these for classroom use, please know that we have the quiz bank on a random generator. That means if you assign this to your students, you will not all get the same questions. Those users who get at least 8 out of 10 questions correct will receive a certificate of completion with your name and the date. As previously mentioned, these certificates indicate that the user has earned 1 contact hour of general management training credit through the IAEM certification program. You can save this certificate as a PDF, and you can also access it at a later date through logging back into your CONVERGE training module account. I'm now going to transition to a live demonstration of the module. While Lori is moving from the slides to the training module site, I want to remind everyone that you can register for the module at converge.colorado.edu/training-modules. Okay, now that Lori is projecting the training module website, I'm going to walk you through a demonstration of one portion of the Broader Ethical Considerations for Hazards and Disaster Researchers training module. For the sake of time, I'm just going to show you the ethical considerations for designing a study in a disaster setting. This section of the module discusses some of the initial ethical questions and decisions a researcher might need to consider when designing a study in a disaster context. The first topic in this lesson is developing meaningful research questions. The first step to designing a study is deciding what questions we want to ask. The questions we ask are imbued with ethical meaning, as they ground the research in what we want to learn and why we want to do the work in the first place. Hulley and colleagues developed the FINDER criteria to assist researchers in framing research questions. While originally developed for clinical research, these criteria are applicable across a range of disciplines within the hazards and disaster fields, including public health, emergency management, sociology, psychology, and other allied disciplines that engage in human subjects research. Here we include a table that presents a modified version of the FINDER criteria and includes some suggestions for how to achieve each attribute. Once research questions are drafted, the researchers should further evaluate their research questions before embarking on a study. The 2019 Public Health Code of Ethics, for instance, can help researchers scrutinize the ethical implications of their proposed research. Here we include another table that lists different questions adapted from this code of ethics that researchers can ask themselves to determine whether their research questions are ethical. The next topic focuses on selecting a study population. Deciding who to research is inherently an ethical question. Disaster-affected populations, whether experiencing primary exposure to a disaster, such as disaster survivors or first responders, or secondary exposure, such as healthcare providers, mental health specialists, or volunteers, may be more vulnerable to the emotional and physical impacts of a disaster than other types of research populations. Moreover, certain subgroups of survivors may be especially susceptible to harm or exploitation in research due to historical injustices and contemporary inequalities. Social vulnerability, shaped by such factors as age, race and ethnicity, disability, gender, and socioeconomic status, may lead to adverse disaster outcomes and require special research protections for certain populations. The act of participating in disaster research may also increase vulnerability of subjects. For instance, if a research reveals that residents in a particular zip code have a higher exposure to a toxin, it could stigmatize them once the results are published, as entities such as insurers may use this information against the interests of the subjects. The next topic is choosing sampling and data collection methods. Disaster researchers use most of the same techniques employed in other types of research, such as surveys and interviews. However, there are many unique challenges they confront with regards to timing and access. Timing in disaster research tends to be constrained, as disaster events unfold suddenly, leaving little time for scholars to plan and deploy for fieldwork. A fundamental assumption of field research is that researchers are as familiar as possible with the local people and setting prior to entering the field. This helps to ensure culturally competent research practices, which are important for ethical engagement with study participants. In the context of quick response disaster research, however, limited time to plan ahead can make it challenging to follow these ethical protocols and may constrain the ability to collect high-quality data. Researchers may also have limited access to disaster-affected populations. Access to study participants influences who is included in the study sample and has the potential to impact equitable sampling of the population. In the call-out box presented here, we discuss some of the factors that can affect a researcher's access to participants in a disaster context. Choosing which data collection methods to use also requires careful consideration of the ethical implications of each approach. Here we use an interactive slider to present some of the ethical challenges associated with different methods commonly used in disaster research. For the sake of time, we'll just click through a few so you can see how it works. Next, we have the collaborating with others topic, where we discuss how disaster researchers can collaborate with other researchers, local organizations, and study participants to help advance knowledge on how to effectively improve public health, emergency management, and other forms of institutional response. The next topic is deciding when to initiate a study. A unique feature of most disaster research is the urgency to start a quick response study in the immediate aftermath of the event. Yet, as we outline in this section, there are a number of ethical repercussions for affected populations and the research community. Here we have a call-out box of an example of an ethical dilemma in the field. It contains an excerpt from Taylor's Review and Conduct of Human Subjects Research After a Natural or Man-Made Disaster, Findings from a Pilot Study, in which the author discusses various ethical dilemmas that they encounter while in the field. The last topic in this section is disseminating research findings. As we underscore in this section of the module, a key principle of ethical research is respect for persons. This principle should extend beyond informed consent to ensure that research participants are also informed of the results and implications of the study. Although there may be specific instances when sharing research results is inappropriate due to the potential harm it could cause participants, the default assumptions should be at least to share some results with participants, as there are a number of potential benefits, which we list in the table here. At the end of each lesson, there's a brief knowledge check, which is a 2-question quiz to make sure the user is engaged and paying attention. The knowledge check does not count towards the final quiz. For those of you joining via your screen, you can see 2 multiple choice questions. The first asks, true or false? Disaster-affected populations are considered legally vulnerable in the United States and are protected by federal regulations. There are 2 response options, true or false. I'm going to press false. The second question asks, the finer criteria are best used to guide researchers to determine blank. The response options are what research questions to ask, who to study, what methods to use, or when to enter the field. I'm going to press the first option so that the sentence reads, the finer criteria are best used to guide researchers to determine what research questions to ask. So to submit my responses, I press Finish Assessment, and and I now have the option to view and check whether I got the questions correct. As you can see, I got both of my answers correct. I wanted to point out one more thing during this demonstration. As I mentioned earlier, the module has a resources tab where additional resources are listed that can support researchers engaged in fieldwork. We have compiled these resources for each of the modules that are currently available. For example, if I press the MacArthur Competence Assessment Tool for Clinical Research link, it'll actually bring me to the instrument. So that concludes our demonstration portion for today. We're now going to return to the webinar slides. We hope that demonstration of the module was helpful. We also wanted to let you know that the CONVERGE training modules to be released next will focus on collecting and sharing perishable data in extreme events research. And following that, we will release another module, which is currently in development, on reciprocity in field research. We will be hosting a brief demonstration webinar like this one for these and other future modules. A few reminders before I turn this back over to Lori to close out this session. To contact us about any questions or suggestions you may have, please email us at converge@colorado.edu. To register for and access the CONVERGE training modules, as well as this module recording, please visit converge.colorado.edu, the CONVERGE website. Lori, over to you.
Rachel, thank you so much for that overview of the module and also for the live demonstration. And just a special thank you to you and Candace for all of the time and effort and care you put into reading nearly 100 scholarly articles and books to assemble this module. And just thank you so much for everything. And again, to our participants out there, thank you for being with us. And we really did want to underscore that much of your work has informed the writing in this module. So please always send us feedback, comments, and additional resources. Now, before we move on and close this webinar out, we wanted to actually give our viewers a quick update, as has become our custom, on how we're doing in terms of registrations and completions for these modules. And so a few quick updates for you all. To date, we're almost to the 3,000 person mark. 2,962 people, including students, academics, government officials, private sector professionals, and others have registered for the CONVERGE training modules. And while most of our registrants are in the United States, we have a growing number of registrants from additional countries around the world. Thus far, 1,033 people have successfully completed the social vulnerability training module, which was our first module that we rolled out. 573 have completed our second module on disaster mental health. 455 have completed the third module on cultural competence. 271 people have completed the fourth module on the IRB and extreme events research. 171 people have completed the emotionally challenging research module, and 22 people have completed our most recently released Understanding and Ending Gender-Based Violence in Fieldwork module. And of course, you all heard today about our 7th and newest module on broader ethical considerations, and we hope that you will complete that or one of these other modules soon. We look forward to seeing your name on a completion certificate. This module that you learned about today would not have been possible without the support of the National Science Foundation and the Centers for Disease Control and Prevention. We also want to acknowledge the entire team here at the Natural Hazard Center in Boulder, Colorado. Everyone on our team has contributed to this module in some way, either through reviewing, testing, or otherwise supporting this effort. Our undergraduate and graduate students and other full-time team members took the time to carefully review the module and to provide us with feedback on the content that you heard about today. We also want to offer a special thanks to all of you on this webinar. And as Rachel noted, we hope that you will sign up for updates via the Converge website at converge.colorado.edu/sign up. So you can learn about future training modules, funding opportunities, and other resources that we are creating through Converge. And so with that, I'm actually going to stop sharing the slides so I can look out and better see the chat and the Q&A. And we do have about 5 minutes left for questions. And so if you do have a question, please drop that in the chat box or the Q&A. And I see that Nancy already asked a question. So thank you, Nancy. And Rachel, I'll ask you to field this one if you'd be willing. So Nancy asked, can these modules be utilized with undergraduate and graduate students who are studying global health and climate change? So Rachel, how would you answer that?
I would definitely think yes. As you saw when we presented the module and provided the brief demonstration, the focus really is on studying disasters, but these include different types of disasters, from natural hazard events to humanitarian crises that can occur. And I think this is definitely applicable to a very broad student audience that could benefit from learning from this module.
Wonderful. And I just building on that, I would say to Nancy, I'll put in another plug for that assignment bank that you heard about at the beginning of this webinar. Dr. Courtney Welton Mitchell, who's in the Colorado School of Public Health here in Colorado, she posted a sample assignment there that she's used with her public health students here. And so just echoing Rachel, that we think and hope these modules will be useful across a range of disciplines, and we hope that assignment bank can help to move that forward. So thank you. And oh, hi, Justin. Thank you for the question. He says, are you or do you intend to include good practice examples? So if, for example, research that is attempted to be as ethical as possible. So moving beyond those ethical dilemmas and challenges. So Rachel, would you like to give some examples of the good practices from this module?
Sure. So we do acknowledge that often there isn't always such a clear-cut right or wrong answer when it comes to some of these ethical dilemmas. However, in that fourth lesson of the module, we actually provide a number of actionable strategies that users can employ to make some of those better decisions. So we try not to label, oh, this is the right decision versus this is the wrong, but we provide strategies that can assist one in making their own decisions in the field. And then we also do present case study examples from past research where researchers have had to navigate some of these challenges and move forward in the best possible ethical way, given the options provided.
Thank you. And Justin, we know this is a question you've been thinking a lot about as far as, are there some common or core ethical principles that might infuse across the disaster life cycle? And so as Rachel said, we really hope that as a starting point, this will be prompting some of those conversations as we move toward those core principles. So thank you for that. And again, everyone who's out there and still with us, know that you can always send us an email at converge@colorado.edu if you have suggestions, resources, or questions. And thank you for being with us. And Rachel, again, thank you for the wonderful demonstration and all the work. And we will wish you all well on this April 15th. And we hope you have a great day. And thank you for joining us. Please take care of yourself and others. Bye.